My name is Laura, and I am a practice pharmacist based in Fleetwood.
And what messages would you like to get out, particularly with regards to people on prescription medication?
Okay, so the key messages during this difficult time are to order as normal, do not order your medication early, don't order extra medication or over order or try and stockpile medication, and to just go about your medicines in a normal way, and that's to help maintain the flow of medication stock to patients.
And some patients are thinking, well, I needed an inhaler 2 or 3 years ago, and I might need one again, or I needed something for a cold 3 or 4 years ago, and I might need that again. What would you be saying about folks that think I need to stock up my medicine cabinet with prescription meds?
Yeah, I can completely understand their concerns and their anxieties around that. But what we would say is to just deal with it on an as and when basis, basically. There's no point getting things in extra just in case, because then that may affect the supply of medicines to people who really need it. If you are unwell or you have a worsening of your respiratory condition, or something flares up that was maybe dormant and you had years ago, we can just deal with it at the time, and you will be managed at the time through your GP surgery or through 111, and we'll get your medications to you when you need them.
Okay, thank you. And the other thing is, it's likely that some medicines are going to be out of stock, and maybe some brands are no longer available for short periods. What would you say to people whose tablets look different?
Yeah, so different medications come in lots of different brands, lots of different manufacturers make the same medicine. So the key thing is, if you are concerned, if something does look different, speak to your pharmacist about it. However, your tablets may look slightly different colour, slightly different shape. As long as the drug itself is the same that's in there, that is the key thing. That's the main thing that you should be concerned about.
Okay.
Obviously, we may encounter challenges where, like you say, medicines go out of stock or things aren't available, but we have that throughout the year anyway, and in normal times, and we'll work our best to sort of make a real solution to that, in that we'd get an alternative preparation, or maybe just a different manufacturer, or slightly different medicine, but we'd want to keep everything as close to the original as possible.
Okay, thank you. Ibuprofen. You will okay talking about ibuprofen, because some issues, people are worried about taking it if they have the symptoms of this virus.
Yeah, the advice on ibuprofen for if you get symptoms of the coronavirus would be to not use it. Just stick, if you can, to paracetamol. Obviously, we know that it is a little bit hard getting hold of that at the minute. So just use paracetamol, avoid ibuprofen, because we're not sure around the effects of that, and with the coronavirus, there's not really a lot of concrete evidence at the minute. If you're already on ibuprofen or on any other anti-inflammatory such as naproxen or anything like that for another condition, we would advise to continue taking it as you would have done before. So don't change your way of managing that condition.